Hello, I'm Ash Dhamma, the CEO of MEDgle, and this here will be an overview screencast of our clinical GPS application. Clinical GPS can be used by pharmacists in pharmacies, nurses and physicians in clinics, as well as in private practice. So why don't we go ahead and jump in and start taking a look at it. So what we can see here are that there are four major sections. The first being the link to our clinical GPS application, which helps people understand what potential diagnoses may be relevant, next steps, and what else they can do. Second is a quick lookup function, allowing them to get details about the diagnoses, procedures, or medications. Third is our search and analytics section, which allows you to slice and dice all the interviews that have been conducted, and this is especially useful in the enterprise setting. And lastly is my account, which allows the person to go ahead and manage their account. So let's go ahead and jump in the clinical GPS. So what we can see here are the four major columns. Patient information, which is entirely optional and potentially to be used when integration with EHRs and practice management systems. Second of all is signs and symptoms, which allows us to go and input the information that has been collected with the patient. Third is suggested questions after we've done an initial analysis from the inputted information. And fourth, here are our current results. So let's go ahead and jump into a potential interview. So let's say, for example, that a patient has walked into a pharmacy. So you're a pharmacist and you're talking with the patient and they're telling you that they're coughing at night. And this has been going on for about 2 days, you know, male, and they say they're 23 years old for this particular moment. So when we go ahead and click calculate, it will go ahead and analyze the information given and come up with our three different columns here: suggested questions, current results, and possible stat procedures. Now in suggested questions, we ask potential emergency symptom questions. These are questions that help us rule in or rule out potential emergencies, as well as lifestyle modifiers, which are relevant, such as smoking, injured, or overweight. Here we have our current results, which shows us what are the potential diagnoses that may cause this particular issue. Above here we have our histogram, which basically allows us to understand how our potential results break down for different levels of emergency level 1, 2, 3, and 4. 1 being life-threatening, 2 being emergent, 3 being urgent, and 4 being same day. This here is an average score which is calculated after analysis of looking at the probabilities, the potential emergency scores, etc. In this particular case, we see an average score of 3.2. So indicating that for a person having a male having cough at night for 2 days, this is not necessarily life-threatening. However, there are things which are potentially life-threatening that we may need to consider but are much less likelihood. Then we have here the genius list, which we'll get to later, which talks about what are the types of diagnoses that one needs to definitely consider because they are life-threatening. And now on this column, what we here see the potential tests that we may need to do to understand to rule out our life-threatening issues, our emergent issues, and then for all the other potential options that they happen to be. In this column, we can go ahead and understand why something might be there. And for someone coughing at night, what we see here, the critical potential concern here is status asthmaticus, and we got to be able to rule that out. And basically then we can go ahead and you take the PO2 or whatever the case is. Now in the case of places like pharmacies or whatever, this may or may not be relevant, but this allows us to definitely understand. However, let's say we know something even more about this particular patient, and let's say that we do happen to know that they are currently, already having asthma. So what we can do is we can recalculate the whole analysis with respect to that new information. And you may know this because this is part of the practice management or pharmacy management application, and therefore, information that is indeed available. And what we see here now is that our results have actually changed, and now asthma happens to be our top result. And then we can look at details about asthma, and that'll go ahead and tell us about the information, common symptoms, related diagnoses, potential diagnostic tests are relevant, and also therapeutic solutions, and also potential things like sponsored information such as Prevental in this particular case for asthma. So what we're seeing here is a very clear example of where we've taken someone who's come into a pharmacy or a clinic and coming in with coughing at night, which is not necessarily immediately thought of as potentially being caused by asthma, but we know they're asthmatic, and it's able to relate this information. And so therefore this really produces a very strong ability for a pharmacist or a clinician, a nurse, or a physician to have a dialogue with the patient, allowing them to really understand what is going on. Now, beyond that, we can also go ahead and look how results may change. Now, if this was a 45-year-old, say a 50-year-old, even though we do know they're they're an asthmatic, we may also need to start considering other types of issues, and this will allow us to analyze that particular reality. Now here, though, the results change, but now we start getting things like acute bronchitis or COPD or cardiopulmonale coming in, though much less likelihood than asthma, and potentially things that people need to start considering. So these may be topics that the pharmacist may suggest that particular patient to go and talk with the physician, or the physician may come up and then want to do additional investigations to be able to rule those out. Um, but basically what we can see here is that this tool is able to provide a pharmacist, a nurse, or a physician a way to deeply interact with the patient where they can understand the options that are being presented, be able to take corrective action, and have a very fruitful discussion. So this here was a very short overview of MEDGle's clinical GPS. If you would like, please do come visit us at medgle.com, that's www.medgle.com, and learn about all the variety of different applications we have and learn more about clinical GPS. Thank you very much. Cheers.